Good afternoon, everyone. It is 3:30, so I think we will make a start. And welcome to this afternoon's meeting of the West Yorkshire Health and Care Partnership Board. I think it's our 16th meeting, but it's also the first one for some 3 years that we've held in person. So I need to remember how to chair large meetings. We have a slightly shorter meeting than usual today due to the development session we held earlier, but key items on the agenda will include a verbal update on the current context for our work from our CEO, Rob Webster, an update on the Tackling Health Inequalities for Black, Asian and Minority Ethnic Communities and Colleagues Work and Action Programme. We have the final draft of the partnership's 5-year strategy for approval and a latest draft of the partnership's climate strategy. So if I can just remind people, firstly, to raise your hand if you would like to contribute to the discussion, and I'll endeavour to keep track of everyone and bring people in turn. When you are speaking, if you can turn on your individual microphone using the buttons in the drawer in front of you, and the first time you contribute, say your name and the organisation. And I realise I didn't do that at the start. So my name's Tim Swift, and I'm the chair of the partnership board, also the leader of Calderdale Council. And also then to remind people to turn their microphones off again when you've finished speaking. Should say that as well as the microphone, the cameras go round according to who's pressed the buttons. So you may have the unwanted focus for longer if you don't do that. I suspect I have a master button here, but I'm not entirely certain, so anything could happen there. Item 2 on the agenda is questions and public deputations, and we've been given notice of 2 questions. The first from Mr. Tom Griffiths, so I'll ask Mr. Griffiths to read his question.
My name's Tom Griffiths. I'm an independent advocate working for Parasol, which is a local community organising hub based in Epton Bridge. My question relates to adult social care. I've been involved in many cases over the last year or two regarding increased charges and changes in care provision as a result of decisions made over the last few years. And my question relates both to the recent report by the Equalities and Human Rights Commission, which found many failings across the country in local authorities' systems of challenging care decisions and how those decisions were made, and also Calderdale Council's own internal audit, which questioned the way these policies were operated in Calderdale. So my question is a twofold one. What has this board and its members done in terms of monitoring and evaluating the impact of community care charges and community care changes in delivery of care? And what is it going to do to ensure that the health and welfare and well-being of Calderdale citizens isn't affected negatively by these changes?
Thank you very much. So what happens at public questions is we may give an initial response now, but then we'll also provide a written response afterwards. And I'm going to ask Robin Tuddenham to respond to that. Robin.
Thank you, Chair, and thank you, Mr. Griffiths, for your question. I'm Robin Tuddenham. I'm the place lead for Calderdale for the ICB and the Chief Executive of Calderdale Council. So in response to your question, Mr. Griffiths, is that the West Yorkshire Integrated Care Board and the Care Partnership do not have a direct role in monitoring the impact of these charges that were introduced by Calderdale Council. Calderdale Council's Audit Committee are monitoring the progress of the action plan in response to the adult care charges internal audit, and last met on the 20th of February 2023. This includes the implementation of a charging policy and a procedure by the Adult Services and Wellbeing Directorate. The Audit Committee will meet again in public in May 2023 to gain assurance of progress. The charging policy and procedures will also be subject to a detailed equality impact assessment to identify and address potential impacts of any changes in care charges or provision that may arise from the policy. Individuals and family circumstances are taken into account at the point of assessment and review, and people do not have recourse to the formal, recourse to the formal complaints procedure. We are currently working to ensure our complaints procedure is accessible to and inclusive of all Calderdale residents, and we are starting thematic reviews of complaints in order to embed lessons and continually improve services. Our partnership has shared ambitions on reducing inequalities, and partner organisations continue to work together to share lessons on the impacts of policy changes such as these. And I understand this will be formally recorded as a response to your question. Thank you.
Thank you. And the second question I have is from Dr. John Puntis. John?
Thank you very much, Chair. So John Puntis from Keep Our NHS Public. There's a short comment really on the 5-year strategy. Very, very aspirational, lots of positive things. Nothing wrong with that, but not much of a sense of how difficult it's going to be to improve matters, given the massive chronic underfunding and understaffing in the NHS. And it's not very good on problem solving, I think. For example, with dentistry, there's recognition, acknowledgement that access to dentistry was a major concern fed back by members of the public, but there isn't anything about how that's going to be tackled. And I think everyone knows it's a really big problem. Only 1 in 10 practices now accepting NHS patients, worsening oral health, particularly in children, and of course, increasing health inequalities. And I noted in the little cartoon video for asylum and migrants, it actually says blithely, enroll with an NHS dentist. Now, I know that's a short film. It's very good in many respects, but people will actually find it extremely difficult to find an NHS dentist. And then another point just in relation to the estate and the hospital building programme, because on page 78, there's actually a picture of the artist's impression of what the new Yorkshire Children's Hospital will look like. There isn't a caption, but that's what the picture is. Now, most people, or a lot of people, I think, regard the new hospital building programme as simply being a scam, because no hospitals have been funded or have gone ahead since that programme was announced 5 years ago. And there's actually no way that the 2 wings at the infirmary could be up and running in the next 5 years. This has been acknowledged by the Trust through a Freedom of Information request. And that's because the business case hasn't been approved. And if it is approved, the funding has to be forthcoming, and that's not a guarantee. So I think there needs to be a bit of explanation of that picture rather than presenting it as something which is imminent, or certainly something which will happen in the next 5 years. So that's my comment. Thank you very much.
Thanks very much, John. Perhaps can I just ask Ian if there's anything you want to pick up immediately in response?
Yeah, thanks very much, John, for reading the document and for the comments. What I'll do is I'll pick those up as part of the 5-year strategy item that we've got later on the agenda, if that's okay. Thank you.
Thank you. And thank you very much to both our questioners for taking the time to come along. Item 3 on the agenda, declarations of interest, just to remind members and those watching, obviously, all existing declarations of interest in your individual roles are already recorded and taken into account, but we would ask if you have specific interests in any of the items on the agenda today, you do make sure they're mentioned and recorded. Item 4 is minutes of the meeting held on the 6th of December. Could I ask, first of all, if there are any comments on the accuracy of those, or are we happy to agree them? In that case, before we go on to the action log, Cathy, I think you wanted to raise one matter arising.
Thank you very much. I'm Cathy Elliott. I'm chair of the West Yorkshire Integrated Care Board and deputy chair of the partnership. It was just something that we discussed at the December board around the Better Care Fund and the variety of funding that comes with that. It's particularly just to invite colleagues across the partnership to share case studies of best practice in using the Better Care Fund, and particularly how local authorities, voluntary sector and the NHS are working together at this time. I think we're very keen to share that best practice across places and services. And my colleague Anthony Keeley is collating those case studies at the moment. Thank you.
Thanks, Kathy, and remind people of that in the minutes as well. And Ian, do you want to take us through the action log?
Yes, thanks. Thanks very much, Councillor Swift. So looking at page 14 to 16 on the notes and actions. So the first action, I'll just focus on the actions in progress and the ones that are still open. So the first one, delighted that Frank and Shannon are here to talk about the climate strategy later in this meeting. So we'll be able to close that after today. The third one down around the diabetes recovery project, an action to take that into the clinical and professional forum, which I believe is happening in April. So we'll be able to close that one off in April. Laura continues to work with governance leads in local authorities to approve and finalise the terms of reference for the integrated care partnership. So we'll keep that on as a work in progress. I think Kate and Gary have been in touch around the sort of Health Watch involvement in the workforce work and the people plan. That meeting hasn't happened yet, so we'll keep that as an open action. The next three are closed. The one at the bottom of page 15, which is around the Race Equality Network and the Workforce Race Equality Standard, and the one at the second down on the next page around the task and finish group around race equality data, I think we picked up as part of the agenda item on the race equality review. Councillor Swift.
Thank you, Ian. Any questions or comments for Ian on that update? Okay, thank you very much. So take us straight on then to item 5, which is our update from our CEO, Rob.
Thank you, Chair. Hello, everybody. My name's Rob. I'm the Chief Executive of the Integrated Care Board and proud to be part of the Integrated Care Partnership. Great to see everybody in public face-to-face again today. So I just wanted to say a few short things at this short meeting. The first is that the Secretary of State and the ministerial team have been meeting with all chairs and chief executives of integrated care boards as part of the new arrangements. And it's very clear that the Secretary of State, when Kathy and I met him, wants integrated care partnerships and integrated care boards to be successful. Now, that shouldn't come as a surprise to us. It's national policy. The legislation that's gone through over the last year is here to reinforce that, but that means that our integrated care partnership has to be successful in what is a quite challenging context, as Dr. Puntis just referred to earlier. I think we can build upon a period, it's nearly 7 years now we've been working together as Sustainability and Transformation Partnership then an ICS. And we are building on practical work that we do together every day on delivery and development work that we do collectively on future strategy. It's worth probably pausing to reflect on the winter that we've just been through, which isn't over yet, it would appear, judging by the weather. The winter we've just been through, which had the quadruple consequences of concerns and increasing morbidity around strep A, a very short, sharp flu season, a COVID wave, and other winter viruses all happening at once. We've been through a winter with industrial action being taken by a number of different unions, and a winter where we had consecutive 4-day bank holiday weekends together, which always cause problems in terms of the coordination and delivery of care. But we got through that winter because we've got a strong partnership, which is made up of the NHS, local government, third sector and communities. And people in this room and their organisations, their institutions, their staff work together every day, 24 hours a day, 7 days a week, to make sure that services continue to be delivered. Those services weren't always delivered to the standards that we want them to be. And we know that we've tried to minimise harm as much as possible during that period, but we want to make sure that we continue to deliver safe and effective services. So when people look at this partnership, when they think about the Integrated Care Board, when they look at the work we do in places and with our providers in collaboration, it's that real practical boots on the ground stuff, as well as the blue sky thinking, the strategy, that's incredibly important. So I just want to thank all of the staff, all of the partners, all of the sectors for the work that's gone on over the winter, because it's been incredibly tough. We have seen a receding of flu, a very short, sharp season that's now receded. We have gone past the last COVID wave, maybe slightly into another one. And we are seeing the worst of winter over with at the moment. Industrial relations remain patchy in terms of the relationship between the government and staff side. It's pleasing to note that the government and staff side are talking around the Royal College of Nursing, GMB, Unison, Unite, which means strikes and industrial action for the ambulance service are off, and that our nursing colleagues have suspended strikes. As we sit here today, there are plans for 3 days of industrial action for junior doctors next week, which, if they go ahead, will lead to delays and cancellations for patients. We are collectively working to minimise the impact of that, as we have over the winter, and we're hoping that both sides come together to talk and those strikes don't go ahead. You may have seen in the news that the consultants have also done an indicative ballot to see whether they would take strike action if required, and that was a positive vote for the unions. And you may have seen that talks between the government and the BMA fell down over the GP contract changes for 23-24. That means that that contract has been imposed and the British Medical Association are considering their next steps. So industrial action, some positive movements, but some things that we're still dealing with. So we're operating in this quite difficult environment, I would say. But it's to the credit of everyone in the partnership that we think we will deliver our financial targets for this year. We've maintained services without declaring major incidents over the winter, and we continue to make substantial progress on things like elective recovery. Our GPs continue to deliver significantly greater volumes of activity. Our community staff, our social care staff and others continue to deliver care every day. Today, I think we've got an opportunity to consider our strategy for the future, which is part of our reset. As we go into the next year, setting a strategy for the future which recognises inequalities, recognises that suicide is still the biggest killer of young men, for example, and recognises our contribution to the economy alongside the need to tackle waiting, look after our staff and children. The opportunity to do that is a really positive one. We will, as Dr. Puntis challenges us, turn that into an operational delivery plan. So this is about real work in real time, making a difference to real people. But this reset around the strategy, the money, the planning for next year, the way that we work together is incredibly important. It's backed by a people plan and a people board, and Kate Sims, the Director of People, and Brendan Brown from Calderdale Huddersfield Foundation Trust chair that board that reports into here. And at the heart of that is understanding that difference matters. Everybody's unique and special, and everyone's got something to offer. And our people plan recognises that difference is a strength. I can't finish my remarks without recognising that we've done some really fantastic work in West Yorkshire on race equity. It's the standing item that we have on every one of these meetings, and it's the next item on the agenda. At the same time, the Chief Executive of NHS England, rightly, and fair credit to her, has apologised. And the chief nursing officers have written to apologise for the outcome of a tribunal where a member of staff in NHS England was racially abused and had to go to a tribunal to get heard and validated. Now, as a consequence of that, because we have some staff within West Yorkshire who were witnesses at that tribunal, we've taken immediate action to ensure that any individual action has been taken, that any action for our organisation, any learning for our organisation is secured, and that all staff who might have been affected have been communicated with. So upon finding out what was going on, we wrote to all staff through our race equality networks to remind them of our commitment to racial justice, fairness and equity, and to provide signposting to support should they need it. We'll talk about that a bit more in a moment, I'm sure. But the key thing for us at this point, I think, is to recognise the work that everybody's done and the opportunity we now have to reset and build hope for the future.
Thank you very much, Rob. Can I ask if there are any questions or comments on Rob's update? Okay, not seeing anybody. Thank you, and endorse your thanks to the staff in particular, Rob. Okay, item 6 then, as previewed in Rob's final comment, is the update on the Tackling Health Inequalities programme, and I'll invite Fatima and Kenise to introduce this item.
Thank you, Chair. Good afternoon, everybody. My name is Fatima Khan Shah. I'm proud to be an Associate Director here in West Yorkshire's Health and Care Partnership. Just want to introduce my colleagues, Kenise Khan and Joe Farn. Joe Farn is the Associate Director for Leadership and Development and is a co-author of the report. And Kenise will shortly be talking about the work we've been doing with our VCSE Voices panel and their feedback. Just to remind colleagues that this report covers 2 sections of the review. One looking at the safe access to work, and that's both physical and psychological safety within the workplace. The second is about the partnership's aspiration to have a leadership which is reflective of the communities of West Yorkshire. So I'm not going to repeat what's within the report, but I think what is really important to recognise for the board to note is that the team are now moving towards, now we've consolidated a very solid foundation of learning resources and demonstrated a commitment to this agenda. We are now moving towards a demonstration of impact. That's sort of demonstrated by a letter that's been co-written by, thank you to our chair, Councillor Swift, and also the chair of our ICB board, Cathy Elliott, which has asked for information regarding the data we have in West Yorkshire on race equality. Now, recognising that we are a health and care partnership, we recognise that this is different data sources. So while most NHS providers do submit data in the national domain regarding the workforce race equality standard, some local authority providers and voluntary community sector organisations will look at data in slightly different ways. So one of the things that we've asked for in the letter is to develop a task and finish group, which will look at not only the data within West Yorkshire, but I think more importantly, the lived experience and case studies to show what it feels like to live and work in our region. I think the final thing I will say as well is that the important element of this is that the resources and the work that we do is only as good as the individuals that are delivering that work. And it's really, really important from a race equality network perspective and a core team perspective that we continue to develop capability and continue to support our colleagues to create safe environments where we can continue to have these difficult conversations, but equally address some of the hard issues, even though they may be uncomfortable to hear. I'm going to pass on now to my colleague Kenise Khan to feedback from the VCSE Voices panel.
Hi everybody, I'm Kenise Khan. I'm the chair of the VCS Voices panel for West Yorkshire Health and Care Partnership. At our latest meeting, we were pleased to see the data, the high level data for the res and the progress that has been made across our region. I do believe it's exemplary. We'd like to thank both the chairs for writing the letter to you all. We've had a standing request over the last couple of years for the data to be collated across from our LAs and from our trusts so that we can compare and contrast. I think we are going to be one of the leading ICBs where it comes to RS data nationally. And that is due to the commitment of the staff for everybody working on this agenda, but also the fact that it's been taken very seriously by all of our partners and not just as a standing item or just to let's talk on the subject. I know that bullying and harassment within staff teams, with experiencing them from patients as well as experiencing them from management is still an issue, and I'm sure we will be working on that in the coming future. And that's all we've got to say on the people agenda, because there was nothing. I think after 2 years it was the first one we felt like we had progress. We could see tangible progress, and all the effort that had been put in was now starting to see light, and it was really a great honor to be part of this journey. We also want to talk about, I know it's not the people agenda, but because it was brought up as feedback from the last meeting at the partnership board and the work that's been done in the background is around commissioning processes. and our VCSE, our diverse VCSE organisations. Now that I feel as if I know that that's got a lot of work that has to be done. There are pockets of exemplary practice on this, and we know that there's some really good work going on within some authorities, but it's not happening across the board. And that is something that we're gonna have to work on in the next couple of years to change. And I know we've got Kim in place as our SRO, and she's fully committed to helping us with progress in that. And I know that our LAs are committed to making that progress too. One final point is, I know that we also know that we've got a staff shortage across nationally. Our VCSE organisations are the ones that are at the front line. They're the ones that can recruit from the communities that we are serving, and we can help and support that progress if you would like our support. That's it from me today. Thank you.
Thank you. So, Chair, we just asked the board to note our recommendations.
Thank you very much, Fatima Kenese. Can I check to see if there are any questions or comments on this item? Yes, Kim.
Thank you. I'm Kim Shuttler. I'm on the West Yorkshire Integrated Care Board, representing the volunteering community and social enterprise sector, and I'm the Senior Responsible Officer for Harnessing the Power of Communities. I just thought it would be a good opportunity to add to and echo Kenese's perspective in terms of the challenges being faced by the sector. I think I wanted to share with the partnership that that there is that commitment across the board, and we have got a paper going to the Integrated Care Board in March, which is going to go into that in a lot more detail. But I don't think we can underestimate the urgency, but also the fantastic work that's going on at our grassroots organisations, which are perhaps the most vulnerable at this moment in time. So I'm really pleased that we have got the commitment from the partnership to action some of that.
Thank you. Any other questions or comments, Kathy?
It's a similar request as before, but I'd really welcome if any colleagues have adopted the inclusive recruitment toolkit that has been recommended through these standing agenda items, and has best practice they could share. We'd really welcome hearing about that. I know my colleagues who write these reports every quarter would really welcome as many case studies and examples as possible to show the impact which Fatima was just talking about. So it'd be really welcomed.
Thank you, Kathy. If Rob, yes.
So I'm just connecting this agenda to the later one on the strategy and some of the conversations we had earlier in the development session around monitoring. So we will know that we've had a positive impact on the commissioning work if the outcomes and the experience of people improves, and we can start to look at some of the indicators that we have differentiated by a number of different protected characteristics. So as we get into reporting back on the strategy, I think we should make a commitment to ensuring that we do that here. We will be doing it at the Integrated Care Board, but we should do it through the partnership too, to see whether we can look by different ethnic groups, the experience and the outcomes of people we support against those 10 big ambitions that we have.
Thanks very much, Rob. Yeah, yes.
Thank you, Chair. John Nebo, representing West Yorkshire Race Equality Network. Just wanted to feed in views from colleagues on the paper that we've discussed. I thought it'd be useful to share that with the board. The network welcomes the progress being made on the agenda, and I think there's lots of good work going on. There was a plea to kind of keep this agenda live and make sure we continue what we're doing here. There was a plea for ensuring that the call to action notes that came out from the chair and Kathy is followed through with places. So that's a really good kind of letter that sets out real evidence-based progress that we want to see on this agenda. We just want to make sure that that is noted as an action to follow through in the next meeting. Thank you.
Thank you very much. Thank you for that. Sorry, Susan, yes.
Yes, that works, doesn't it? Just looking through the paper, I just wondering, obviously there's some very good activity going on, but have we got, I know I'm one to criticise card targets, but have we got some targets with this in terms of representation and senior management in the next 4 or 5 years, which is what we're trying to reach towards? Irana Sen MP has challenged us in Bradford, and similarly, I feel that we should be looking at that in West Yorkshire as well. Thank you.
Thank you. Fatima, yes.
Thank you, Councillor Lynch. That's a really helpful point, because one of the things that we focus on as part of the work of the independent review is ensuring that our leadership is reflective of West Yorkshire. We're looking at sort of a 20% target, because the average sort of proportion of people, the global majorities, we now refer to them in West Yorkshire, is around about 20%. One of the things that we've done, and it's referred to within the report, is recognise that if you want people to be in the leadership forums of West Yorkshire, we've got to address the fact that they don't get beyond middle management, which is why we've got to sort of look backwards to enable us to reach forward. So it's just to assure you that we are making significant progress, and literally the faces of West Yorkshire are changing, but it will take time to deliver. And I hope that gives you the assurance you need.
Rob?
So I think if the councillor is, I think if I'm hearing right, Councillor Hinchcliffe's requesting a trajectory towards delivering the target when we set the operational plan. I think that's a good idea.
Thank you. There are no other comments. Then thank you again for presenting that item, and we're asked to agree to note progress and note the report with those comments. Okay, thank you very much, everybody. So item 7 is the partnership's five-year strategy. We had previously received this at December meeting, and ask Ian to update us on where we are and the key points in the final draft.
Thanks very much, Councillor Swift. And I'm joined by Esther Ashman from the ICB team, who's done the majority of the work on this document. So remember that we brought a draft, a working draft to the partnership board in December, and that followed a conversation that we had in September, where we presented quite a lot of insight from Health Watch colleagues about what folk in West Yorkshire were telling us about services, health and care services. So the purpose of today is to share what we hope is a final draft of the document for final comment and hopefully sign off. The feedback that we received in December, there's probably 3 main themes coming out of that. I think the first one echoes what Dr. Punt has said, which is around getting the tone of the document right, you know, the balance between realism versus ambition. And we have tried to alter the tone of the document slightly, particularly through the forward from Councillor Swift and Rob, but also through the content of the document. So it'd be good to get views about whether we've got that tone right. It's, as I said previously, it's not the easiest thing to do, but I'm grateful for views on that. The second comment we had was that it was light on digital and the role of digital in transforming services and digital inclusion. And we've addressed that in the current document. And the third was reference to the work that we're doing around creative arts and the role of creative arts in improving health and well-being, and we've addressed that as well. So since December, we've had another tour of health and wellbeing boards in West Yorkshire. Pretty good support for the document, pretty good feedback, and again, we've refined it further based on that. And we've also been to West Yorkshire Overview and Scrutiny Committee to discuss the draft with them. So subject to your agreement today, what we'll do is we'll finalise the document. We'll develop an easy read version, a plan and a page, a British Sign Language version, and hopefully we'll finalise this start of the process. This part of the process, as Rob mentioned, in parallel with the strategy, we're developing a joint forward plan. And this is a new requirement in ICBs as part of the legislation that came in the summer. And what that joint forward plan will do is it will describe in more detail how NHS partners are delivering the specific aspects of the strategy, as well as meeting the national requirements that have been set out in the planning guidance. So that's a work in progress, but I think that will provide some of the detail that you're asking for, Dr. Punters, as well as some of the choices that we need to make as a health and care partnership in order to deliver our ambitions. And the deadline for producing that document is June this year. So keen to get final views. Hopefully you'll see the changes that we've made that have reflected previous comments. And what we'd like to be able to do is sign off the document at the end of this meeting. Esther, is there anything that you wanted to add?
Thanks, Ian. I'm Esther Ashman, the Associate Director of Strategy for the West Yorkshire Integrated Care Board. Just a couple of additional things to add is just the engagement that we've had with Health and Wellbeing Boards has been fantastic. And the leads locally have taken their own Health and Wellbeing Board strategies alongside the West Yorkshire one, so that we can really illustrate that we've built this from the places, which is really important. The other thing is just in terms of the way we work to deliver this strategy. OD has been at the heart of this work to develop the strategy, and it will continue to be in terms of the delivery, because if we want to create this future that the strategy describes, then we need to start working differently to do that. So I know Joe's in the room as well, Joe Farn. I'm working really closely with Joe around that agenda. In terms of some of the comments that have been made in previous items as well, as Ian alludes to, there is the joint forward plan that we do need to develop. It talks in the guidance about that being an NHS element of the plans, but actually in West Yorkshire we can't really separate the two things, NHS and partners, so it will be a little bit more of a flavour of how we would work in West Yorkshire, but we will make sure there are clear trajectories in all of that. We're working really closely with partners across the whole partnership to be able to make sure we can describe some of those trajectories, some of those milestones, and how we'll be able to each year evaluate the work and see where we're up to and whether we need to do anything differently. And lastly, we're just making sure that we really do build in far more experience of care into that work as well, so that we're not just looking at some of the traditional outcomes, but also how people are feeling that they're receiving care and services, and what's their life feeling like at that time as well. Thank you.
Thank you. Ian, perhaps I could ask that you picked up some of the points John put just mentioned. I just wonder if you want to say anything specifically about the capital point about the Leeds Children's Hospital.
Yeah, I mean, I'm conscious that Phil Wood from Leeds Teaching Hospital is in the room as well. I mean, you know, I think we can change the picture in the document if that's the thing that's misleading. I mean, we've still got time to do that within the document, but I don't know if Phil wants to comment on the current position on the Children's Hospital building Leeds.
Yeah, thanks, Ian. Phil Wood, Chief Executive for Leeds Teaching Hospitals. So we've been working very closely with the New Hospitals Programme for several months now, and we are expecting some of the outputs of the meetings that we know have happened over the winter months in the next few weeks in terms of an announcement around forward progress of the programme.
Thanks. Rob, did you want to come in?
I think it's important for us to recognise there are a range of capital developments that we want to progress in West Yorkshire. And as we do, those capital developments have an economic and a clinical and a social value to them. I don't know if Brendan Brown wants to talk about what's going on in Huddersfield at the moment. I think that's a brilliant example. Sarah Munro could talk about what we've done with Red Kite View. But I think we need to make sure that as we work on the Leeds hospitals, as we look at Calderdale Royal Hospital, as we look at Airedale Hospital, the replacements that are required in Leeds and York partnership, that the clinical improvements that we see, the improvements for staff and patients in the environment that they inhabit, are seen alongside the social and economic benefits of those developments.
Thanks, Rob. Susan, yeah.
So this isn't a huge, these objectives aren't a huge difference from the previous version we had, which I liked, so I'm not complaining about that. So I think that's good. It's just, obviously this is 5-year strategy, and have we got therefore a timeline about when we're going to bring this back and check progress? What numbers are we looking at to make sure we're making a difference? And if we're not, then we need to interrogate ourselves as to why we're not shifting on some points as much as we should be doing. Because obviously we've got some bold ambitions in there. We need to make sure we achieve them. Thank you.
Thanks. Got 2 or 3 comments. I'll bring 1 or 2 people in if that's all right, and then come back. I've got Brendan and then Fiona. Brendan.
Thank you. I was only responding to Rob's comment about the social value piece. I'm Brendan Brown. I'm the Chief Executive at Calderdale and Huddersfield. I think it's summed up in good work for our people, means, well, we would hope for prosperity and opportunity. We can often think new hospitals means jobs for doctors, nurses or allied health professionals, but it's much bigger and bolder than that. And I think about the next generation of our colleagues who will be managing our hospitals potentially remotely. They'll be maintaining them in a very different way. And I would hope that through the social value and indeed the conversations that are taking place around our new hospitals, that we'll have lifelong ambition for our people. I think it speaks to the work that Kate's leading on in the People Board. It'd be good to have a session here probably on social value and what that means for the people of West Yorkshire.
Thanks, Brendan. That will be interesting. Fiona. Sorry, I've no idea.
Oh, lovely. Right. Thank you. I've never had that power before to switch on my own microphone. I've got a few comments. I think it's really positive that this strategy is very rooted in the reality of people's lives in the way in which it references, explicitly and comprehensively the cost of living crisis, but also access to health services. It was a criticism of an earlier iteration of our health and wellbeing strategy in Leeds that it was a very aspirational, lovely plan, but actually our citizens can't get to see a doctor or a dentist, so aren't going to find this relatable. And we've amended our plan as a result of that. So I feel it's really positive that this strategy references the context we're in and makes comments like it explicitly states the suicide rate will be impacted by factors outside our control. And I think that's really appropriate that it is rooted in the lives people are living. And also I welcomed isn't quite the right word, but I appreciate that it also references the state of local government finance, because we have recognised that as a huge risk across the whole system. My final comment I've made before, so I'm sorry to be repetitive, but I really feel in the cost of living section, when we're talking about our staff, that we should mention what we pay them, because we are big employers across the system. And the most effective way we can tackle the cost of living crisis with regard to our role as employers is by paying our staff the real living wage. So the strategy talks about some of the lovely schemes that are in place to support staff around cost of living, talks about well-being around cost of living, but actually the most significant thing we can do is to pay people properly. And I know we're not there yet, but there are many aspects of this plan where we're not there yet. The whole point of it is it's aspirational. And therefore, I feel really strongly that it should make some reference to being good employers with regard to pay and the real living wage, even if that's aspirational, it's not where we are currently, because that's the biggest impact we can have as big anchor institutions in the areas we work in. Thank you.
Thanks very much, Fiona. Any other comments? Rob, do you want to come back?
So I just wondered if Kate wanted to say anything about the work of the People Board and whether we should offer some insight and input from the People Board about what the opportunities for moving towards the real living wage for all sectors was, what the costs were, and how we might take that forward.
Thanks, Rob. I'm Kate Sims. I'm the Director of People for the ICB, and thank you for your comments. I recognise you raised some of these points previously. I recognise, I think the point that's been raised there is in terms of what's our articulated ambition in this regard. It's not an easy area in terms of, if I look at pay disparity across the partnership, it is quite significant. So I think if we were to put some ambition into the strategy, we'd have to be really clear at what extent that needs to be taken. I think in terms of the People Board, there's two aspects. There's the cost of living piece that's already been referenced. And I think that there is some work that's currently underway about firstly making sure that all of our colleagues across the partnership are aware of the support and help that's out there. But I also recognise, that there are aspects around making sure we have career movement and opportunity across the sectors. And I think one of the pieces that we're working hard in the board, we now have the People Board broken into the themes, and the next one is very much about growing our workforce across West Yorkshire, is about recognising that this is a collective workforce and what we can do, not just in terms of recruitment campaigning, but to really attract people who can move across the sectors. And that does perhaps address some of the aspects then in terms of pay and terms and conditions. I think if we are to go beyond that, we need to be clear about what is the ambition that we collectively wish to articulate, but certainly happen to take some of that back into the People Board discussions.
Thanks. That's really interesting, actually. And I think we probably do need to think about how best we bring that discussion back and how we structure it. I mean, I have to say I'm aware as I'm listening to your comments and thinking about the challenges local government face with social care as well. I don't feel personally I have an overview of just where we are across the partnership as a whole in terms of real living wage and the costs and challenges. So, and we need to be honest and open about just what those are, I think. So I've got both Robin and Rob. I don't know which order. You're each too polite, Robin.
Yes, thank you, Chair. Maybe building on Councillor Venner's comments on, I think, work and good work. I think this is a really good strategy. It's really well framed. It's ambitious, and it maybe this is a handling issue more than a content issue, but I just wonder whether or not we're quite at the point of reflecting our ambition in the economic growth section, where we're talking a bit about kind of our role as employer, but actually less about the role of work in health and in good health. And actually, we don't want, I don't think it's probably feasible, and it won't work, to have a single strategy for the Mayoral Combined Authority and the Health and Care Partnership, but actually the work of the Combined Authority and the work of local authorities and all of us in place around work is one of the greatest, if not the greatest, contributor to health. And I'd say that the Resolution Foundation had just produced a really powerful myth-busting account of the reasons why we are facing the biggest workforce crisis in the next decade we've ever known. Our population, unfortunately, are getting older, iller, frailer. 3.5 million people are unable to work because of poor health. And that's by far the biggest reason that is contributing to people over 50 not being able to work, not the kind of retirement and I want to go off and do something else thing that the media cover a lot. So it fundamentally is a contributor to both well-being, productivity, and people living good lives, to keep people in work and connect people to work at a time when we don't have enough people to do the work. So it just feels almost an existential crisis that we are going into. And I don't know whether or not it reads as much of a burning platform as it feels it is at the moment. I know there's a lot of work going on around this, but it really is fundamentally striking. So I think Torsten Bell said, I think, that sadly, if you get out of work over 50, by the time you've been out of work in 18 months, you're more likely to die in the next year than get back into a job. So the consequences of being out of work at that point is, and then when people get into that, around about 2% actually get back into work when they get to 2 years out of work. So there's a point in time where you lose people. And then fundamentally their life chances and those their families are affected. So I think it does feel that one of the big challenges for us the next 5 years. Thank you.
Thanks, Robin. Rob?
So as ever, Robin's made some powerful points there. And I'm minded that last time we signed the strategy off, we did it in concert with the economic strategy. So we had a joint session, and the industrial strategy was signed off at the same time as the 5-year strategy for the ICB. We haven't done that this time. And maybe we need to have a conversation with the Combined Authority, the Mayor, about how we can contribute further to the economic strategy. And I know that skills, innovation, and the creative industries are all deep connections to the work that we're doing here and to the economic strategy, and the work that we do here informs the elements of the industrial strategy that cover those areas. So there's definitely things for us to do. Again, I think some of this speaks to the work that Kate does. Some of it speaks to this partnership having a people board which accounts to us here, and maybe making that a bit firmer and crunchier as we come out of the strategy, so we can talk about what choices we would have to make about pay, how we think about the health of our staff. So the other thing that Robin said that really struck me was, we will talk here about there being a 21, 22 year difference in healthy life expectancy. And we will talk here about our staff, about, you know, people being unwell. But when we look at our sickness rates, they tend to be 1% higher in our region than in England. If you think about that, for it's 1% of 100,000 people. That's a substantial slug of folks who don't come into work every day. If we supported better as they reach their 50s, as we were employers, would be better for them, better for the economy, and better for our organisations. So there's a huge amount we could do here. I think the final thing I'd say, Councillor Swift, is that just to make sure that people are aware, we have been working closely with central government, as Phil Wood described, on Leeds and all of the capital programmes that require central funding. So there are a range of those. We've raised them with the Secretary of State. We've raised them with Robert Jenrick. He's been replaced by Lord Markham. Lord Markham's coming to see us to look at the capital needs of us. So we will continue to lobby for and ensure, if there's national capital required to deliver local schemes, that they're at the forefront of ministers' minds so they can make the right choices.
Thank you, Rob. Tony?
Yeah, just a thought. I mean, the issue that Robin raised around the over 50s and access to work is an absolutely key one for us in Leeds. And we've been doing some research into that locally, and unquestionably it's one of our major challenges that we've highlighted in our health and wellbeing strategy. We've had a couple of pilots in primary care that have been quite effective, which obviously would be good to share that. But just remembering what we did a couple of years ago around some of the housing issues, when Wakefield was sort of leading housing and health, and there was a bit of an exercise across the patch to understand what everyone was doing. I think it would be quite useful maybe if we could replicate a similar thing for employment focused on that over 50s group, but also whether there's any strong evidence and effectiveness for some of the groups that don't have access to work. Though we know there's hidden talent, learning disability, mental health, refugees and asylum seekers. It's certainly, as I say, something that we're prioritising in Leeds, but we're less certain of what the evidence is, other than some stuff that we've had from Manchester and a visit over there recently.
Thank you. So I think there's clearly a strong strand of work we would like to see developed there around workforce and that 50+ working issue, as Robin and Tony have highlighted so effectively, and perhaps that's something to take through the people board and then bring back to this group. Are there any other comments on the strategy? Liz, yeah.
Hi, thanks, Chair. So I'm Liz Mear, Chair of Kirklees Place. Really welcome the strategy, especially the additions Ian's mentioned, the potential of digital to transform, but not that being our only way to deliver services, looks really good in the strategy. And I was really pleased to see the clear the diagram talking about how Place works, how it works with the ICB, how we reach out to local people, how that is part of our strategy and how we can implement the strategy in our local areas. And I think this discussion we've just had outlines some of the ways that we can do that, and we can build that into our place-based agendas. So really welcome it. I think it looks good. The additions are great.
Thank you. Ian, is there anything you want to come back on?
Well, just to say thanks very much for the comments and for reading the document. On Councillor Hinchcliffe's comments around measurement, I think that's key. We presented some measures and metrics that we were using to demonstrate progress against 10 ambitions at the December meeting. I think we need to refresh those and keep bringing them back to future meetings. We had a conversation in the development session earlier on about how we structure the future board meetings, you know, alongside those priorities and those 10 ambitions, and getting a bit more process around that, I think would really help. I think we should put something in, even if it's a high level aspiration around being a good employer. Councillor Venner, I can agree a form of words with Kate on that, that reflects the work of the people board. I think Robin's spot on about the points around strengthening the priority around economic growth. We've actually got a consultant in public health joining us, I think, in a week and a half's time, working between the ICB and the combined authority to lead our work on this agenda. It's important to us, we're prioritising it in terms of capacity, and we can reflect that in the document. And I think those were the main things, but thanks for the positive feedback as well. It's really appreciated.
Thank you. Kathy?
Great. Thank you, Ian and Esther and colleagues. I've just got a couple of questions. And I suppose this is just helpful in understanding, as we all appreciate, there's lots of national reports that come out regularly, and colleagues across our partnership are involved, such as the Fuller Stocktate, and colleagues here, Fatima and Rob, are involved in that nationally on looking at primary care. We've had the Messenger review on leadership and opportunities for development, which Dame Linda Pollard, who's chair of Leeds Teaching Hospital, is involved in. And a passion for me is particularly the government's women's health strategy that came out in summer last year. And I just want to, Ian, and Esther, whether you just talk through how you weave in these kind of national strategy, because they're there for recommendations, and our colleagues in the voluntary sector and in local authority will have other examples as well. And the second part of my question, which I know came through in the discussions, consultation, engagement in putting this strategy together, is how do we measure progress? We have a variety of targets together we need to deliver, but there are things that we want to do together in places and for services in our communities. And I just wondered if you'd talk about that and any further support that's needed on that, please.
Yeah, so in terms of the national strategies and national priority documents coming down, Kathy, there's often quite a lot of them, so we need to be quite judicious in terms of how we manage those. Otherwise, it could end up as a very large document. I mean, hopefully you can see themes of the Fuller review coming through this document and other sort of key national documents. We'll keep an eye on those, and as part of the annual refresh process that we're doing as part of the strategy, we'll ensure that we're reflecting those appropriately. On the measurement point, we have got a set of metrics that relate to the 10 ambitions, and we presented those as part of the package of material that we shared in December. I think the discipline for us as a partnership board is how we monitor and review those regularly, including the collective actions that we need to take to support their delivery, and carve out time at the partnership boards to do that in a more structured way. So that'll be the plan following the development session earlier today.
Okay, thank you. With those comments and actions identified, then are we happy to note the work and approve the final draft subject to any final minor amendments? Is people content? I'm seeing plenty of nods and no shakes of the head, so I shall take that as positive. And thank you very much, and thank you again to everybody who's contributed throughout this process. Rob.
So can I just wanted to test an addendum to the recommendations, really, which is probably a point of emphasis, which isn't about the strategy, but I think about the next steps. So we've heard from public questions, and we've heard from members, and we've heard from Healthwatch that access to dentistry is a substantial problem. And from the 1st of April, the resources that currently sit with NHS England in terms of money and people will transfer to the partnership to manage. That will be on a like-for-like basis. So if we want to tackle access to dentistry, it's likely that we will have to reprioritise some capacity and some money to do that. And the Integrated Care Board would happily look at options for that. And I think it'd be helpful just to receive a steer today that that would be something that was prioritised by the Partnership Board. If people are happy with that, I think I'm hearing that people want to achieve that.
Views and comments, Susan?
So I'm happy to look at a paper. This is something that we as leaders have looked at over a number of years, actually. And my understanding was, without changing, now what is it called? It's some 2006 Act nationally, that it's very difficult for us to get dental services right in West Yorkshire. So we're taking on the commissioning, but not without all the powers, is my understanding. And I think we need to be able to be really honest and open with the public about what we can achieve given the constraints nationally that are put upon us. So it's a while since I looked at this subject, but I seem to remember I was really excited to find out we were going to be able to do it in West Yorkshire. But when I looked under the surface, it wasn't quite as positive as I'd hoped.
Thank you. So I'll just bring Rebecca in on the same point, then come to Ian and Rob.
Thank you. Yeah, thanks. Really good to hear the bit about the dentistry. I just wanted to ask the question of whether the budget for commissioning is going to be coming down to, or has come down to, ICB. So when I was working in public health, we were wondering about whether as a public health intervention, you could target funding that was underused for dentistry for children in schools, in deprived communities, as outreach sort of health promotion work for children who perhaps otherwise might not get to a dentist or couldn't access a dentist. So that way it would be well used, targeted, and very impactful, and just wondered if that was something we could be thinking about.
Thank you. Ian?
Yes, so I think it's fair to say that the national dental contract doesn't incentivise the kind of activity that we would like it to incentivise. I think it's also fair to say that there is still stuff we can do within that contract, and there's already stuff that's happening in the Yorkshire Humber commissioning team to use that contract a bit more flexibly than the sort of within those national constraints. And I know there's a real appetite across the ICB to push that as far as we can. So that's the first thing. I think there's more flexibilities there than we might have initially been led to believe. I think the second thing is that every year a chunk of the money that comes to Yorkshire and Humber for dentistry is clawed back to NHS England because it's not spent. The total value of the dental contracts aren't delivered to their full extent because there's a lack of capacity, and that money goes back to NHS England. By bringing that resource and that decision making into the ICB, we can potentially be a bit more creative with that money. If we know it's not going to be spent, you know, what could we plan to do at the start of the year that would be exactly in line with what Rebecca's suggesting in terms of working differently, or the practices that we can work with who are delivering the full value of the contract that we might want to commission a bit more with. I think all these options are on the table for us. And the initial conversations we've had with the Integrated Care Board is that there's a real strong appetite to be as ambitious as we can around that. I think that said, it's clear that services aren't going to miraculously improve after the 1st of April. But I think looking at short-term actions around using the money we've got to best effect, plus longer-term actions around workforce recruitment, retention, you know, I think there's things that we can do that are better than they currently are now. And I think from the feedback that we've had from the Health Watch survey and citizen engagement, I think, you know, that should be a priority for us as a partnership.
Thank you. Rob?
So I think that's exactly right. All of that is exactly right, and will take capacity to manage. So the current capacity that will transfer from NHS England will not be substantial. So as we enter a period where running cost allowances are pressed, prioritising this, I think, is probably a good thing, and we'll need to look carefully about how we do that. So I think that's the steer. So I think Rebecca's made some great points about how we're flexible with the use of resources. That's reflected, I think, in the strategy around the health promotion, health protection side of things, and also integrating dentistry into the teams a bit more locally. So there's much to do, but we will need to manage it, and that will probably take some capacity in the short term.
Thank you. Kathy?
Just to share with colleagues, some of you know that we have our regional representative from NHS Confederation with us today, and this is something that as a membership body that they're looking across systems. As you know, there's 42 systems in the country on systems that are already taking this delegation. So we will learn from other systems, and Councillor Swift, just referring back to the discussion on economic development and healthcare's contribution to that. There's also a report that came out from NHS Confederation that I think we can look at and learn from as well. So I think we'll draw on other systems and learning as well, particularly as we do this from April.
Thank you. So is there support for Rob's addendum in terms of priority? Yeah, Susan, you want to come back?
So I'm in favour of anything that shifts some money into children's health, and if that's what the dentist contract is going to do, that would be great. I mean, it is appalling as a service, NHS service for dentists across West Yorkshire. If we can improve that in any way, I'm obviously supportive of that. But I think it needs to be seen as a wider shift in trying to focus more on children's health. I think that's a really important element of what we should be doing here at local level.
Thanks, Susan. Okay, Helen.
Yeah, Helen Hurst, Chair of Caldell and Huddersfield Trust. So I'm going back in my history now in terms of as a previous sort of Commissioner of Dental Services, and although I think it feels like a good thing to say and do, but I think there's a reality around the national contract that may make it almost impossible. And so I do wonder whether or not we would be better, as well as using our sort of position, I guess, around some national lobbying towards more appropriate health improvement type of national dental contract, as opposed to one that rewards widget counting. Because I think there was a lot of work done in the sort of late 2000s to try and get, certainly for children's dental services, a much more health improvement type of model. And it would be good to be able to have another go at that, I think, as a partnership, if we have the opportunity to do so.
Thank you.
So it's certainly something, as Cathy said, we're discussing with the NHS Confederation. It's also something that colleagues may be aware that there is a Leeds Health Hub with the Department for Health and Social Care between the partnership, the Leeds place and the department. And part of that is looking at policy. We've said, how do we make policy better? How do we make policy work in ways which are reflective of communities and systems? And one of the areas that we would look at would be dentistry. So I think we've got plenty of options to do that, Helen, I think. So if we're exploiting the flexibilities in the contract, and that takes people in negotiations, if we're using the resources more flexibly and if we're lobbying for change, we might have a recipe that works.
Okay, thank you. That's everything on that item and that addendum. So I think we'll be looking really to see what comes back from the ICB board in terms of, as I understand, how we can maximise the money that's already in the system to be as effective as possible, and particularly around that issue of children's health, children's access to dentistry, which is probably the real crisis point that many of us feel right now. Thank you. So that brings us on then to the final item of today, which is the climate strategy. So I'll ask Frank and Shannon to introduce this item. Thank you.
Thank you very much, Councillor Swift. My name is Frank Swinton. I'm the climate change lead at the partnership. I'm also a consultant anaesthetist at Airedale Hospital. I'm going to hand over to my colleague Shannon, who's helped me very much in writing of this strategy, to give you some of the context.
Good afternoon, everyone. So as Frank introduced, I'm Shannon Kennedy. I'm a public health specialty registrar on placement in the climate team at the ICB. I won't belabor the content too much of the documents, but I did want to perhaps give a bit of context that might be helpful for understanding. So the first is just to explain that the timing is quite convenient in that it helps to be sort of having done at the same time as the 5-year strategy for the partnership. So this has been an opportunity to help align the content of the climate strategy with some of the wider thinking and wider context, not only of that strategy and the joint forward plan, but also the wider context of things like statute and policy, both nationally and more close to home. So this also brings into account then in the documents things like one of the big ambitions for West Yorkshire, number 9, just focus specifically on climate, but we were also quite keen to make sure that we draw out in the document the fact that achieving all of the other 9 big ambitions is kind of predicated upon getting climate right, because it's so vital to elements of inequality and around overall sort of health and well-being outcomes, that it's a fundament really of being able to achieve all of the other things that we want to be achieving within the partnership. So we've tried to take this as an opportunity to draw that out and make that explicit, to think about how what we're presenting as a working document really for comment and engagement, that what's in there can really help us drive forward these wider ambitions by taking a strategic approach and by thinking about how to embed climate, not as a sort of make it something that's part of everybody's business, and really something that weaves through all of the wider work that happens within the partnership. And that's a way of really increasing the capacity then to bring to bear on this work, rather than having it sit in a sort of discrete silo. So in terms of that aspect of it as being sort of a working draft for comment, we're obviously keen to hear feedback today. And it's already been through some engagement so far with things like net zero leads and other key climate leads across the partnership. But the intention is, once we have some assent from the assembled members today, there will be some finalization work, and we would hope to have a final document later this spring that builds on what we think is quite a substantial change from the sort of formal life of the strategic document that was guiding the climate work previously. One of the key elements that you may have noticed is sort of a menu of actions. So that was something that we were very clearly asked several times in the development of the documents that people wanted was, great, we'd like to do something about this. Please tell us what to do. So we've tried to balance a sort of high-level strategic view with trying to give quite a broad menu of actions that can, if undertaken at the right level and contextual kind of approach for each of the different members of the partnership, will really bring things on in terms of actual achievement of those ambitions, rather than people trying to decide what would help them do that in a sort of vacuum or in the abstract. So I think, hopefully, as I say, that's provided the context in which these documents sit, and what we would hope to do after today with it that can help guide some of the comment and discussion today. Thank you.
Thank you very much. So can I open that up for questions, comments and feedback? Tony, yes.
Yeah, thanks, and really welcome this document. I like the balance between individual advice to organisations, and the wider societal advice as well. In Leeds, we're in the process of pulling together our approach to climate and health as a system as well, and there's absolutely a lot of things in here I think we can learn from. I think there's aspects of it are really radical and really ambitious. And particularly the things around things like food poverty and car ownership. And obviously, I think probably most parts of local government would really like to work with you on that as well. So just a couple of points in terms of engaging with the people that are working on things like transport and environmental planning in local government, but also the combined authority, because you'll probably be aware that transport is one of the combined authority's big priorities, and the big challenge, as we know, anyone who either drives or uses public transport at the moment knows how extensive those challenges are. So setting some common targets, I think, across the system for local government and for health, I think would be really welcome. So just sort of opening that up just to have further engagement with you on a number of these areas, and really welcome the radical approach, and I think that will help in local conversations too.
Thank you. Any other questions or comments at this point? Rob, yes.
So I wondered if I thought it was very helpful looking at the table of actions around what could my organisation do, and then thinking about recent experiences that we've had around mutual accountability and peer review. I know Robin and I were discussing last week about the Calderdale peer review and the positive progress that had made. And in the early development session, I think Helen was talking about making sure that we held each other to account on various things. Whether we could use this as a framework for mutual accountability, where organisations invited others in to say, look, how do you think we're doing against this framework? Or we set some expectations around the application of the framework. If we were really serious, I mean, every place in West Yorkshire has declared a climate emergency. I don't think it's contentious to say we should be doing these things. But so it might be that if we saw this as a kind of framework for self-assessment or mutual accountability, peer learning, we could use it in that kind of space.
Thanks, Rob. Yeah, sorry.
Frank wants to.
Frank, yeah.
Thank you, Councillor Swift. I just wanted to come back to Rob and say I'm not going to stand in your way. But it's also important to note that table has not been written or intended as a comprehensive. If we tick all of these boxes, we've cracked it. But it's definitely a really good start. And if it were to be used as in the way that you're describing, we could refine and reiterate.
But I think the other experience is if you start working through that as well, you may then find that of itself generates other ideas and issues that should be in there as well. So that would be an interesting approach, perhaps, to experiment and pilot as well. Okay. Just sorry, yeah, Kathy.
Just particularly in terms of citizens being encouraged, I wonder if we invite our colleague Karen Coleman just to talk about the work that's developing with Health Watch on West Yorkshire Voice that might link quite well with what you're recommending there. So putting you on the spot, Karen, but I think this would be helpful for Partnership Board to hear about.
Thank you.
Thank you, Kathy. Afternoon, everybody. I'm Karen Coleman, very proud to work the Partnership in Communications and Engagement. So we're doing lots of work at the moment across West Yorkshire, really keen to reach people who don't often want to come forward and share their views on their health and social care services. And I think that's a big job for us because we really have to get ourselves up and about, don't we, and make sure that people feel comfortable and incentivized to join us. And that includes paying people for their time, their travel expenses, and also making sure that they are involved in things that are of interest to them. So I think it's really important, Frank, that we seize that opportunity, what you've just talked about, and we put that as a theme for our West Yorkshire Voice. And in an ideal world, what we'd have 2,000 or 3,000 people. Some people would want to meet with us weekends, evenings, some on telephone, some on Zoom, and some face to face. But we'll definitely be collecting them themes and seeing how people want to get involved, and that their views will feed into this board and they'll also feed into our integrated care board. The important thing I'd just like to add, this is not replacing local work that takes place across our local places. This is building on them networks, working together with them networks, but also giving individuals a choice to get involved at a West Yorkshire level too.
Thank you very much. And thank you, Frank and Shannon. And sorry, Robin, yes. Oh, and Brendan.
Yeah, thanks, Chair. Just thanks to Frank and Shannon for this work. I think I like Rob's suggestion about an enabling, an enabling document that sort of supports mutual accountability and becomes something we aspire to. It's quite tricky, I think, on this agenda, isn't it? The balance between you have to you should do. And I don't think we can rely entirely on a please will you, because I think there are some choices here. And it sort of links a bit into my earlier bit about work, really, about actually our role as an employer, our role as an employer of choice. You know, if you live in Calderdale and parts of the Calder Valley, the climate emergency isn't something we've just declared, it's something you live. And it's just over 4 years since we declared the climate emergency in Calderdale, and we live it. Because it feels very real. And actually for people looking to work in public services, being an employer that takes this seriously is quite a lever and quite a pull factor for the talent within West Yorkshire to want to come and work and stay here and be associated with an organisation that thinks this matters, because Generation Z, it matters. So I think we need to see that as a bit of a kind of pull rather than necessarily just a kind of something you have to do. And with pride, saying that we can achieve this will be something that each organisation should feel proud about. Thank you.
Thank you, Robin. Brandon?
So I think Robin's captured some of the points, but I really like this piece of work. I know there will be a huge amount of work and effort gone into this. And the litmus test for me was it made me think, right, I am a man of a certain age. What will happen to somebody who's sitting? I was looking at the stones on the wall with, talking about some of the great leaders in this city. It made me think, are we doing the right thing for the future generation? So the next man who's sat in my seat, who's in 52 years' time, who will be 52, are they going to say we did enough? And I think that's what this strategy made me think, are we doing enough? I think on a very practical note, though, it made me think, we live in a complex world. The environment we're all operating in is becoming more and more complex. And it might be a question for Ian. Perhaps there's a piece of work we need to do about a read across for all of our strategies. Are they underpinning one another? Are they duplicating? Are there unintended consequences? Has it created consequences? I just think there's a well-led piece that we need to consider about our multiple strategies in all of this.
Thank you, Brandon. Susan?
It's just a practical question really on fleet. I notice obviously it says no new internal combustion engines in fleets from 2025, 27. I just wondered, do you have a handle on how much fleet you've got and whether how many diesel vans you've got within all that? And of course, there's hospital transport as well, isn't there? There's a lot of, obviously it's really damaging for young people's health, all that diesel fumes in roads or across the region. I just wondered, are we on top of the numbers for that? I don't know. I've never thought about your stock, actually. I thought a lot about our own, but not about yours. So I just wonder what those numbers are.
I don't know the answer. Can I just, isn't it something like 11% of all journeys in the UK are to an NHS appointment or someone driving to an NHS appointment? Is it? Okay, I'd exaggerate slightly. Significant number,
Yes.
but actually a modal shift around connection both to staff and patients accessing health services is significant, isn't it?
Yeah, can you?
Yeah, thank you. So yeah, you're right, Robin. About one vehicle in 20 on the roads in the UK is supposed to be in on NHS business, and this really ties in with what this gentleman was saying about linking in with the local authorities and the combined authorities, because we do need modal shift. Whether we like it or not, we're going to have to get out of our single occupancy vehicles as we currently understand them. And that is something that we absolutely would welcome and are happy to work on. To answer Councillor Hinchcliffe's question, I don't have the numbers immediately to hand, but what I can tell you is that the big trusts in the region do all have a handle on their fleet. Not so much grey fleet, because that's obviously much more difficult, but the fleet which they own and control. And there are NHS targets for reducing, really quite ambitious NHS targets for reducing that fleet, either to get rid of it or transition to electric vehicles, or even increasingly, even better, e-cargo bikes are within urban centres are being seen as a real game changer, because you're not tied nearly so much to the traffic, and you're not moving huge boxes of steel around to move one set of patient notes or whatever. So the change is very much coming.
Okay, thank you very much, and thank you for that item. I think covers all the comments, and presumably you'd welcome comments fed back outside of this meeting as well as we move on to the next stage of finalising the strategy. So thank you very much, everybody. That concludes the planned items. Just check, I'm not aware of any other business. So could I thank everyone for their time and contributions today, both in the formal and the earlier development session, and wish you all a safe journey home. Thank you.